Good afternoon, guys. I've got your B for you. We're discussing public misunderstanding of heart disease, a deeper look. Headline: More than half of U.S. adults don't know heart disease is leading cause of death, despite 100 years, 100-year reign reveals a uh, starkling disconnection between epidemiological epidemiology, logical reality, and public perception. Despite heart disease maintaining its position as the number one killer in the United States for over a century, a 2023 Harris poll commissioned by the American Heart Association, AHA, found that 51% of adults failed to identify it as such. This gap in awareness is not just a statistical curiosity, it has profound just a minute. Okay. It has profound. Let me change paper. Implications for public health, policy, and personal behavior. Historical and epidemiological content. Heart disease has consistently topped mortality charts since early 20th century, outpacing cancer, respiratory illnesses, and infectious diseases. The AHA annual heart disease and stroke statistics report underscores this enduring dominance, citing cardiovascular disease as responsible for nearly 1 in 5 deaths in the US each year. Yet, this longevity may paradoxically paradoxically contribute to its invisibility. What's familiar often fades into the background of public concern. Why the public gets it wrong. Several factors contribute to this widespread misunderstanding. Gradual progression. Unlike acute illnesses, the that demand immediate attention, heart disease often develops silently over decades. Its symptoms: high blood pressure, elevated cholesterol, fatigue, can be subtle or dismissed until a major event like a heart attack or stroke occurs. Compelling narratives. Diseases like cancer receive more dramatic media coverage than uh, philanthropic attention. High profile campaigns such as breast cancer awareness, month of celebrity testimonials about rare conditions skew public perception toward more visible threats, optimism bias, and denial. Many individuals believe they are personally immune to serious illness, especially if they feel healthy or a younger. This psychological distancing reduces motivation to engage in preventative behaviors. Fragmented health messaging. Public health campaigns often focus on isolated behaviors, e.g., smoking, uh, cessation, exercise, without clearly linking them to cardiovascular outcomes. This uh, dilutes the urgency of heart disease and as a unidentified threat. Consequences of low awareness. The implications are serious. Delayed prevention. Without recognizing heart disease as a leading threat, individuals may skip routine screenings or blood pressure, cholesterol, and diabetes, the key indicators of cardiovascular risk. Under investments in public health. Uh, mis rep, represent rep misperception can lead to reduced funding and political support for heart health initiatives, from school nutrition programs to urban design that promotes physical activity. Missed opportunities for early intervention. Lifestyle changes are most effective when adopted early. Lack of awareness delays these shifts, increasing the burden of disease and healthcare costs. What can be done? The page emphasizes several practical strategies to close the awareness gap. Reframe messaging. Heart disease should be portrayed not as an inevitable consequence of aging, but a preventable, manageable condition. Campaigns must emphasize that cardiovascular health is relevant to all ages and backgrounds. Promote routine screenings, blood pressure checks, cholesterol panels, and glucose monitoring should normalize and accessible, especially in underserved communities. Leverage storytelling and community engagement. Personal narratives, especially from diverse voices, can make the risk and realities of heart disease more uh, relatable, culturally tailored. Outreach can dismantle myths and foster trust. Integrate heart health into broader wellness efforts. Nutrition, mental health, sleep, and stress management all intersect with cardiovascular outcomes. Historic approaches resonate more deeply than soloed advice. Final thought: the fact that heart disease remains the leading cause of death while being under recognized by a majority of Americans is a sobering reminder of the limits of awareness alone. Bridging the gap requires not just better information, but more compelling, inclusive, and actionable communication. The AHA's report is a call to reimagine how we talk about heart health, not just in clinics and classrooms, but in kitchens, workplaces, and communities across the country. Okay, guys, that's your B for you. I will be back on shortly with C. Give me a bit to put that together, please, and I'll be back on with that for you as soon as I can. Thanks.